Have you got dry, cracked corners of your mouth? You might have angular cheilitis, also known as angular stomatitis. In today's video, we'll go through everything you need to know about angular cheilitis. We'll go through the causes, symptoms, some treatments, and at the end we'll go through some prevention tips. Let's get into it. Angular cheilitis is a really common condition causing inflammation in the corners of the mouth. It's not contagious, so can't spread from person to person. It can last a few days and go away by itself, or it may persist indefinitely depending on the cause. In the corners of the mouth, either one side or both sides, you may experience bleeding, redness, painful cracks, crusting, oozing, blisters and swelling. There are a number of different causes that can cause angular cheilitis. When the corner of our mouth gets dry, we tend to lick our lips, which causes a buildup of saliva and its digestive enzymes. The buildup of saliva creates a warm, moist environment, which allows for fungus and other bacteria to grow easier. So the main cause of angular cheilitis is a buildup of fungus, particularly caused by the yeast candida. It can also be caused by bacteria and sometimes an unknown cause. Any condition that makes the corners of the mouth more moist is a risk factor. These can include wearing of a mask, dry chapped lips, braces, ill-fitting dentures, eczema or dermatitis, rapid weight loss which leads to reduced skin elasticity, smoking, a bite that doesn't line up, medications that can cause dry lips such as isotretinoin, also known as Roaccutane, poor nutrition which can lead to nutritional deficiencies, in particular iron, B2, zinc, B12, folate and general protein deficiencies, thumb-sucking anemia, Down syndrome, systemic illness such as Sjogren's syndrome, certain types of cancer, diabetes, and particularly inflammatory bowel disease such as ulcerative colitis and Crohn's disease, and immune disorders such as HIV. It is made worse by licking of the lips. Firstly, you can start by applying some Vaseline or petroleum jelly to the corners of your mouth. This can help to hydrate the skin and also form a barrier to protect it from the saliva. Now, if the angular cheilitis is caused by fungal infection, it's best to treat it with an antifungal cream such as clotrimazole 1% or miconazole 2%. Apply this twice a day to the corners of the mouth and continue for at least 14 days after symptoms disappear. If there's a lot of inflammation, you can also add on a mild corticosteroid cream such as hydrocortisone 1%. Apply this twice a day to the corners of the mouth until the inflammation disappears. Then make sure you continue with an antifungal cream for at least 14 days. You can also get a combination product containing both the antifungal and the corticosteroid cream. And after that, make sure you switch to a regular antifungal and make sure to continue for at least 14 days after symptoms disappear. Now, if the cause is bacterial, you might need to go to the doctor to get an antibacterial cream. Tip number 1, improve hydration to the skin. Use a lip balm or a thick ointment to prevent dry lips. Tip number 2, avoid licking of the lips. If your lips are irritated and dry, apply the lip balm or ointment rather than licking your lips. Tip number 3, correct any nutritional deficiencies. Make sure to take the relevant nutritional supplements to correct any deficiencies you may have. If you're unsure if you have any nutritional deficiencies, then make sure you speak to your healthcare provider. Tip number 4, quit smoking of cigarettes. Tip number 5, replace ill-fitting dentures. Tip number 6, rinse your mouth after using a corticosteroid spray. If you don't rinse your mouth, the corticosteroids can stay in the mouth, which increases the chance of any fungal infections and angular cheilitis. Tip number 7, maintain good oral and dental hygiene. Tip number 8, if you have diabetes, make sure your sugar levels are under control. If they're not under control, you're more likely to get angular cheilitis. So that comes to the end of our video on angular cheilitis. If you've experienced angular cheilitis and have anything to share, make sure to comment below. If you like this video and want to see more, make sure to subscribe and we'll see you next time. Bye!